Hello, my name is Penina Laker, and I'm an assistant professor of communication design at Washington University in St. Louis. Saying No to Stigma, Making Mental Health Visible in Rural Ugandan Primary Schools is a one-year pilot project funded by the Africa Initiative at Washington University in St. Louis. The overall goal of the study is to develop a set of age-appropriate, culturally relevant signage and messaging around mental health and stigma. The visual solutions will be developed through a set of extensive hands-on creative workshops and focus groups with children as well as school administrators. This project is done in collaboration with two of my colleagues, Dr. Ozge Sensori Baha and Dr. Proskovia Nabunya, both at the Brown School of Social Work, as well as co-directors of the International Center for Child Health and Development. This collaboration combines social work's commitment to mental health intervention in low resource communities with communication design strength in using design research and community-based practices to address social problems with the goal of developing stakeholder-informed visual solutions. There are widespread misconceptions and stigmatization of people with mental health illnesses in sub-Saharan countries, including Uganda. Uganda alone reports that 12 to 29% of children presenting mental health symptoms when screened in primary care clinics. Common misconceptions include fears of contagion as well as perceptions that people are responsible for their illnesses and are dangerous. Images have a deep history that is closely linked to perpetuating stereotypes associated with the portrayal and treatment of mental health related issues. However, when designed with the input of primary audience members, images can educate and unite people across age, gender, social, and economic differences. Additionally, images and visuals are, if used as a part of learning, is a proven integral aspect of early childhood development. This is an example of images that are seen in a local primary Ugandan classroom. So, why a school-based mental health approach? Schools can act as a protective environment where mental health awareness can be established and promoted, or a risk environment where mental health stigma is perpetuated. While Ugandan schools use visual messaging and signage for sex risk behavior and HIV and AIDS knowledge and prevention, no such strategies are currently adopted to raise mental health awareness and address mental health stigma. Among the interventions outlined to improve mental health literacy, identified according to an article published in the National Library of Medicine, we see community campaigns focused on youth audiences and school based interventions that are geared towards mental health literacy, reinforcing help seeking skills and peer to peer interventions as critical interventions. Interdisciplinarity and collaboration, which brings together a diverse set of individuals not only across academic disciplinary lines but also involving community partners, is a critical part of learning the true needs of a community and arriving at solutions that are appropriate for their context. Interdisciplinarity allows for us to leverage each other's areas of strength, such as the social sciences evidence-based approach and design's audience-driven approach as they work together towards a common goal of addressing complex challenges. Our study was conducted in 3 phases. In phase 1, participants were recruited from lower primary levels 6 to 9 and upper primary levels 10 to 13 to provide baseline knowledge on mental health related challenges and perceptions on the use of visual signs in general. And we also used the focus groups to understand their attitudes towards using visuals to address mental health stigma in the school. Each focus group had 6 to 8 participants, and semi-structured interview protocols were used to guide the discussion. In phase 2, hands-on creative workshops with the same group of students who participated in the focus groups were conducted. Feedback and initial designs from these sessions informed the final design solutions that would be displayed in the school environment. Because this project was done during a time of COVID-19, our workshops were facilitated virtually alongside our Ugandan-based research team with over 30 participants in the course of 2 days. In general, activities prompted participants to draw and share about emotions and different scenarios that are related to mental health deterioration. They did this both in small and individually and in small groups. Feedback through discussions helped us understand the effectiveness of the proposed visual materials in communicating messages that promote good mental health and reduce stigma. Our team incorporated the feedback from these sessions to inform the final design of the solutions displayed in the school environment. Embeda is Obongo, the general well-being or state of the mind. This is how the students defined what mental health is. When asked to create images that depict someone who is struggling with a mental health related challenge, their images depicted subjects experiencing feelings of sadness, loneliness, and isolation. In some drawings, characters are illustrated as part of a narrative, with captions explaining the reason for their deep emotional state. Some are crying with their arms crossed in a self embrace or huddled in a corner because of an issue attributed to abuse by family members. The findings from these workshops highlight strong socio and cultural correlations between early life experiences, family stability, poverty, and conceptualizations of mental health. Overall, the students identified the onset of mental health, illness, and behavior as a result of predisposing factors, such as sudden passing of a loved one that would position the child in a breadwinning role, or unstable family dynamics. Poverty, a lack of school fees that disrupts their school attendance, or isolation by other peers while at school. When prompted to visually document their responses to these behaviors, the students depicted visuals with messages that show a combination of both peer and community based interventions, as seen in these illustrations. The findings and products from this study will serve as preliminary findings to build upon a larger study that proposes a randomized control trial examining the impact of the visuals in raising mental health awareness and reducing stigma among school going children. Thank you.